Well, if you feel like you've been dealing with dry and irritated eyes this winter, you are not alone.
Right. Our Lorin Richardson went to Higgins Brothers Vision Care in Plainville to talk about some remedies to help.
A vision for treating dry eyes.
I want to know, how can I impact their quality of life? How can I get them to function again without thinking about their eyes 24/7, so that they can just get on with their life and live a normal, happy life?
Owner of Higgins Brothers Vision Care in Plainville, Dr. Donald J. Higgins works every day to do just that.
It's a very difficult time of year, simply because of the cold temperatures, lack of humidity, your skin feels dry and your eyes are dry. So yeah, it's a bigger issue this time of year.
Plus, with so many working from home or staring at screens all day, it can add to that stress.
With people using computer screens being home now, there's a tendency to stare. When you stare, you don't blink. And it creates a whole cascade of events. The surface of the eye becomes dry.
For anyone walking in the door at Higgins Brothers Vision Care, it all starts with a thorough evaluation.
We start with a very, very thorough history, looking at the medical history, medications, lifestyle, followed up by a very extensive diagnostic examination that's going to look at maybe 32 components of their dry eye condition. And then we come up with a very targeted treatment plan for those patients.
Dr. Higgins says one of the biggest triggers is usually meibomian gland dysfunction.
It's the root cause of almost 86% of dryness and dry eye conditions.
After a proper diagnosis, there could be several options.
We've got some new steroid eye drops that are specifically designed to treat these cases. One of the companies called Isuvis. It's a great product that treats these peaks and flares.
But the sooner you can treat dry eyes and get to the bottom of it, the better.
I do want to stress that I always tell patients there's always something that can be done, but if they have the glands already there and they're just not functioning properly, it's much easier for me to rehab those glands, get them functional again, than it is to treat them when the glands are already atrophic and have dropped out.
Dr. Higgins says a procedure called Optolite uses optimal pulse technology to manage dry eyes, and he says it's some of the most amazing technology he's seen in his experience.
It goes to the root cause. It tightens up these little capillaries that just don't belong there. The inflammatory cells go away and the meibomian glands start functioning again. It's amazing.
Many patients, like Ewelina Kodzikowska, are trying it out. The procedure takes only about 10 to 15 minutes to perform.
It's relatively painless, and it's one of those like day spa procedures where, you know, there's no really preparation to it, although I do request women not wear their makeup when they come in.
So we got to see a bit of it for ourselves.
When we set the instrument based on skin type, how much they tan, certain ancestries, and then we set it, I can customize it quite a bit.
You kind of get comfortable on this big chair. Dr. Higgins puts some drops into your eye cup. He has to unfortunately cover your eyes, so that may kind of feel a little bit different because you don't know what's going on around you.
1, 2, 3.
It's a intensive light pulse therapy, so you kind of feel a little bit warmth on your face and a bright flash of light, even though your eyes are covered.
It actually melts the meibum in these glands, so very often the oils will become, like I said, inspissated, they thicken and congeal, so they just won't turn over. So after we do Optolite, the meibum has been melted, and then we can manually express these glands. So that's what we're after. We're turning over. That's not perfect oil. As I said, should look like virgin olive oil.
The whole process takes a couple visits, but can be a game changer.
My eyes started feeling less dry. You have to have few of these sessions done for it to work, but I definitely started feeling my eyes are not as dry as they used to be.
For Dr. Higgins, no matter what the issue, his insight on how to treat dry eyes and his passion for it is always 20/20.
If I had all the money in the world and 6 months to live, I'd be here right now doing the same thing. I mean, this is just such exciting technology. And it's not the technology, it's how you actually help these patients.
All right, if you're interested to make an appointment with Dr. Higgins and get an evaluation, you can contact Dr. Higgins at his office or check out the website, drdhiggins.com.
Yeah, right there on the screen. What a great solution. All right, thanks so much. And there's still much more to come on Great Day Connecticut just ahead.
We'll be back in 2. Stay with us.